to do for you today is a massage for plantar fasciitis. What this condition is when your calf muscles, especially your gastrocnemius and your soleus, is so tight that your plantar flexes your foot. And that motion is when you're stepping down on a gas pedal, and it's fixed in that position, and it causes the bottom of your foot, the plantar surface, to be incredibly tight and very uncomfortable. So what you want to do in a massage like this is really work on the superficial calf muscle, which is your gastrocnemius, and if you need to proceed deeper, go into the soleus. So what I'm going to do is start the massage with clean hands, of course, no lotion, and we're just going to warm the muscles up. If you would just go into the massage, you would shock the muscles, and you might cause a lot of discomfort for your client. So we're just going to warm up the calf, and after we just do a little effleurage, or just some nice smooth gliding, what you're going to do is you're going to flex the knee, and you're going to do a lateral stretch on the calf, and we're going to hold it for about 20 seconds. And then you're going to go down the middle to stretch through the middle of the calf for 20 seconds. Okay, in the last stretch, when you turn the foot in medially, and what this does is stretches all three areas of the superficial gastrocnemius, which is the superficial calf muscle, and that is the biggest muscle that wreaks havoc of the plantar fasciitis condition. So we're going to put the leg down, and what I use for this massage is some massage cream, and I use very little just to moisten my hands so we don't have a lot of skin friction on the client. And this also helps with the traction that you need to give so you can do the techniques for the condition. So we're just going to warm the muscles up again, making sure there's no skin friction, like I said. Just nice and smooth. Let your client relax for the massage. And now, your gastrocnemius has two body muscles. It's mostly in the posterior of the leg, and then the other one is on the lateral compartment or the outside of the leg. So the one thing you would love to do is strip up the gastrocnemius from the bottom, and what you're going to do is go through where the body's split. Now this is uncomfortable for your client, but remember to tell them pressure is going to help this condition get better. But after you do the stripping and you add pressure like I'm doing now, what you're going to do is just do some nice soft gliding afterwards so the muscle isn't completely shocked. Now what I do is some myofascial on the calf, on the gastroc, and I just kind of go from the split of the muscles down to the outside of it, and I just kind of work up and down the muscle for just a couple minutes. This is the time to check for any knots that are in the gastroc or the soleus. What these knots do in these calf muscles is make the calf muscles so tight that it pulls that foot into the flexion position, which is what really causes the discomfort for the client. But just make sure to reassure them that you need to work the calf muscle very well so it can help prevent this condition from getting any worse. So after you use some gliding techniques, the next thing I like to do is some muscle pulling and a little bit of skin rolling. This is going to help this muscle just relax and become more pliable. When it's more pliable, it's going to just relax the foot into a position where the client is going to be able to walk without orthotics or without pain. So for everyone to know, my subject has a knot right here in the bottom of his gastroc before it goes into the tendon. So what you want to do, so they don't completely jump off the table, and you don't want to use too many thumbs in the massage as a massage therapist, because your thumbs are your most important tool that you can use, and if you can save them, save them. So what I like to do is bend my index finger into a point. I find the knot and I wiggle. And I just wiggle a little bit because it helps the point of the finger of that knuckle get into the knot a little bit more efficiently and sufficiently to get it out. When someone has a knot, what you want to do is get in there as gently as you can, but when you're in there, make sure you put enough pressure in there to break up that fluid that's building up into the tissue. And every time you release from that pressure knot, just do a little gentle gliding or kneading. It will bring blood through the whole tissue, and it won't be so much pain or discomfort for your client. Just to let all of you know, when you relieve knots and pressure points in the calf or anywhere else in the body, your client's going to feel uncomfortable. Do not give them the impression that it's a comfortable massage when you find knots. Be very forward with them and very straight. So I relieve the knot in this calf. So what I'm doing now is just some nice gentle pressure, because what we want is to decrease as much as we can some of the discomfort that's felt when you release the knot. And now, when you release the knot, you're going to want to go back and do some just kneading and some more pliable techniques in the gastroc and the soleus, because now these muscles are very aware of what's going on, and they're going to be more subject to the manipulation that you give to the soft tissue. Okay, so the next thing that you want during the massage is a tendon, is what connects your muscle to your bone. So your Achilles tendon is just the tendons coming off your calf muscles, which is your gastrocnemius, your soleus, and your plantaris. These three muscles make up your calf, and these are what makes up the Achilles tendon. And the best thing that you can do is just go to the sides of it. Do not press directly on the tendon, but just the sides, and just do some light stripping up the tendon. This will just relax a little bit more of what you just did to your superficial calf muscle, and it'll just relax a little bit, and then we'll work on the foot. So So now that we're going to work on the foot, what you want to do first is just do some gliding up the plantar surface and around the heel. What this is going to do is just warm up the tendons that move the foot in this area. Now, the best thing to do is try not to use any lotion actually on the bottom of the foot, so your client is safe to walk on it when they're done, and it helps the traction of the stretching with the myofascial you do on the bottom of the foot. So what we're going to do is start at the top of the foot and just kind of use the palms and stretch out those tendons. Go from the middle, the medial portion of the foot, out to the lateral part. You're going to start at the ball of the foot and just work your way down, all the way down through the heel. Go ahead and go up the surface to make sure those tendons are very well relaxed and that the Achilles tendon where it hooks to your heel bone is nice and pliable, because this is all going to make this massage worth it to your client. So the best thing you do for plantar fasciitis on the bottom of the foot is you use the best tools that massage therapy has, and it's your thumbs. So what you do is you're going to start right at the heel, and you're just going to push outward with nice medium pressure. And when you're in the middle of the foot or the medial portion of the foot, you can always really dig in a little bit, and as you go out to the lateral part of the foot, ease up so that it's more comfortable for your client. Depending on the severity of the condition, is what the time it takes on the plantar surface of the foot. If it is in a severe condition, spend a good amount of time, at least 20 to 30 minutes, on some myofascial techniques for the plantar surface of the foot. If someone is in their third or fourth session with you and they're feeling better, you may not need to work as much, but make sure you make that the plantar surface of the foot is pliable. And I mean pliable so that you take the bottom of the foot, make sure the heel is supported, and just stretch that foot up. What this stretch is going to do is going to stretch the plantar surface, and it's going to release the tendons into a more workable state. Now go ahead and take the heel of your palm and just do some exercise or some nice slow kneading at the bottom of the foot. Now, if this is too uncomfortable for your client, please do not do this, and please just listen to your client and make sure that they feel very safe and secure during the massage. And once you finish doing that, just go ahead and just do some gliding up the foot and around the heel, so that once again, a soft gliding to relax the muscles. This is a quick overview of what you do for plantar fasciitis. If someone continues with this in the other leg or has compensation issues, feel free to do the same massage on the other leg. With stretching and myofascial, this massage should benefit the plantar fasciitis condition. Now, I do this as a blind massage therapist, so I do everything by touch and by feel. And if you guys, as a therapist, cannot do this, start massaging with your eyes closed on test subject and see if you can feel the muscles better. If you have any questions or any comments about this massage, please feel free to leave them down below. I will get back to you. Thank you for watching. I appreciate it very much. And don't forget, no sight, no problem.